Good afternoon, Listondale. I am Mihiraa. Let's start the warm-up session. How do you handle situations where a patient's cultural beliefs or practices conflict with the standard medical care protocols?
In such situations, I prioritize cultural sensitivity and respect for the patient's beliefs while also ensuring their safety and well-being. I approach the patient with an open mind, taking the time to understand their cultural background and the significance of their beliefs. I then collaborate with the patient, their family, and other healthcare team members to find a solution that respects their cultural practices while also meeting their healthcare needs. This may involve modifying treatment plans, seeking guidance from cultural liaisons or interpreters, or engaging in cultural competency training to better understand and address diverse patient needs.
Can you share an example of a time when you had to advocate for a patient's rights or needs within a healthcare setting?
I once encountered a situation where a patient's treatment plan was being adjusted without their consent, leading to confusion and distress for the patient. Recognizing the importance of patient autonomy and informed decision-making, I advocated for the patient by facilitating open communication between the patient, their healthcare provider, and the interdisciplinary team. I ensured that the patient's concerns were heard and addressed, and that they were actively involved in the decision-making process regarding their care. By advocating for the patient's rights and needs, I helped empower them to make informed choices about their health and treatment.
How do you approach providing care for patients who are experiencing severe pain but are hesitant to take pain medication due to fear of addiction or side effects?
When caring for patients in pain who are reluctant to take pain medication, I take a holistic approach to pain management that incorporates non-pharmacological interventions and patient education. I work closely with the patient to explore alternative pain management strategies, such as relaxation techniques, guided imagery, physical therapy, or acupuncture. I also provide education about the risks and benefits of pain medication, including information about addiction and side effects, to help alleviate the patient's concerns and empower them to make informed decisions about their pain management. Additionally, I collaborate with the interdisciplinary team to develop a comprehensive pain management plan, tailored to the patient's individual needs and preferences.
How do you prioritize patient care and maintain quality of care during times of high patient volume or acuity?
During times of high patient volume or acuity, I prioritize patient care by triaging patients based on the severity of their condition and ensuring that those with urgent needs receive immediate attention. I collaborate closely with the interdisciplinary team to streamline workflows, delegate tasks effectively, and optimize resources to maximize efficiency and minimize wait times. I also communicate transparently with patients and their families about any delays or changes in their care plan, and I strive to maintain open lines of communication to address any concerns or questions they may have. By staying organized, flexible, and patient-centered, I can ensure that each patient receives the highest quality of care possible, even in challenging circumstances.
How do you approach providing emotional support to patients and families during times of distress or crisis?
Providing emotional support to patients and families during times of distress or crisis is an essential aspect of nursing care. I approach these situations with empathy, compassion, and active listening, creating a safe and supportive environment where patients and families feel comfortable expressing their emotions and concerns. I validate their feelings and experiences, offering reassurance, encouragement, and practical assistance as needed. I also collaborate with the interdisciplinary team to provide comprehensive psychosocial support, including access to counseling services, support groups, or spiritual care, to address the emotional and spiritual needs of patients and families. By providing holistic care that encompasses both physical and emotional well-being, I aim to promote healing, resilience, and coping during challenging times.
You can now start the role play.
Good morning, Mihiraa. Good to see you. Could you please confirm the reason for your today's visit?
Hello, Nurse Liston. I'm here because we have an upcoming trip planned, and I'm feeling a bit anxious about how to manage my child's asthma during our travels.
Mihiraa, I can understand how overwhelming it might feel to have a trip with your child's asthma in mind. But please know, you're not alone in this journey. With careful planning, the right precautions, and heightened awareness, we can make sure your child's asthma doesn't hold back the joy of your family vacation. It's essential to recognize that while asthma requires attention and management, it doesn't have to restrict your plans. By taking proactive steps, we can create a tailored management plan that addresses your child's specific needs and ensures their safety and comfort throughout the trip. Let's work together to develop a comprehensive plan that covers every aspect.
That sounds reassuring.
For better understanding, could you brief me about your trip?
Well, my main worry is managing my child's asthma symptoms while we're away from our usual routine and medical resources. We'll be traveling for about a week to the countryside, and I'm not sure how the change in climate and environment might affect his asthma.
That's a valid concern, Mihiraa. It's important to be prepared. Let's start by discussing some steps we can take to minimize any risks. Certainly. Let's break it down. First, it's crucial to make sure you have all of your child's necessary medications packed and ready to go. This includes their inhalers and any other prescribed medications they might need. Take a moment to check the expiration dates on these medications to ensure they're still effective. I'd also suggest packing a little extra of each medication, just in case your trip gets extended or you encounter any unexpected delays. It's always better to have more than you need than to find yourself without enough. Another helpful tip is to have a copy of your child's prescription. This can come in handy if you need to get a refill while you're away or if you happen to misplace the original prescription.
Got it. I'll make sure to pack everything as you said and check the expiry dates.
Absolutely, Mihiraa. Now, let's talk about triggers and how to navigate them with care. Asthma triggers are like little sneaky culprits that can set off your child's symptoms, so it's important to be aware of them, especially when you're away from home. Things like pollen, dust, and pollution can be hiding around, waiting to stir up trouble for your child's asthma. To help keep these triggers at bay, consider using allergen-proof bedding in your accommodations. This can create a safer, more comfortable environment for your child to sleep in, reducing their exposure to potential allergens. Additionally, Mihiraa, keeping an eye on the pollen count during your trip is a good idea. On days when the pollen count is high, it might be best to stick to indoor activities to minimize your child's exposure.
That makes sense. I'll keep an eye on the pollen count and try to plan indoor activities on high pollen days.
Excellent. Mihiraa, it's important for us to ensure your safety and well-being, especially when it comes to emergencies. To do so, let's outline some emergency protocols together. Firstly, we'll create an action plan tailored to your specific needs and medical history. This plan will include steps to take in various emergency scenarios, such as who to contact and what immediate actions to take. Additionally, it's crucial to educate caregivers or family members who may be with you during an emergency. We'll make sure they understand your medical conditions, any medications you're taking, and how to assist you effectively in case of an emergency. Furthermore, if you have any upcoming travel plans or destinations in mind, it is better to collect emergency contacts at those locations. Having local emergency contacts can provide an extra layer of support and assistance if needed. Mihiraa, do you have any other concerns?
I'll make sure to have all that information handy. Is there anything else I should be aware of?
Lastly, it's important to know when to seek medical help. Mihiraa, If your child experiences severe or persistent symptoms, or if you feel like their asthma isn't responding adequately to medication, don't hesitate to seek medical assistance. It's better to be cautious, especially when you're away from your usual healthcare providers.
Understood. Thank you so much for all your help, Nurse Liston. I feel much more prepared now.
You're welcome, Mihiraa. I'm glad I could help. If you have any other questions or concerns before your trip, don't hesitate to reach out. Safe travels.